Ministers announced that the NHS will recruit 1,000 new social prescribing workers to support GPs tackle loneliness and other mental health issues. Instead of defaulting to medicine, these workers will link patients suffering from mental illnesses to non-medical services. For example, community support groups and social activities such as art, cookery, and dancing classes.
Apple, grab. And grab. Again, and up. And up. Roll.
Particularly, social prescribing is considered a key way to boost the health and well-being of those suffering from loneliness. However, local mental health charities say that social prescribing won't be possible if the funding doesn't come through. Tower Hamlets Friends and Neighbors is a local befriending charity that provides emotional support to people experiencing social isolation and loneliness. We asked its chief executive, Rajesh Kalan, what he thinks of this issue.
Social prescribing, it's a very, very good idea, but the important thing is that the money has to follow the client. So we get referrals from local social prescribers who send people to us, but what they don't do is the money doesn't follow at all.
On the other hand, London-based therapist and mental health expert Sally Baker believes that overcoming loneliness is down to ourselves. What do you think about the government's loneliness strategy? Do you think social prescribing will help?
I don't think it can be prescribed. You can give people guidelines, you can advise them, but people have to want to. People have to be ready to connect.
Loneliness is considered one of the greatest public health challenges of our time. A 2018 Cigna survey revealed it can be as harmful to our health as smoking 15 cigarettes a day. And the percentage of people suffering loneliness is only set to increase in the next few years.
People are more disconnected. We've all moved away from our families. We're changing countries even. There are strategies that people can put in place. This is not a chronic, incurable thing. People need to be as proactive with their social lives as they are with their work schedule.
Loneliness can increase the chances of developing life-shortening health issues, such as heart disease, higher blood pressure, and obesity if not treated. The problem is that the stigma around loneliness often prevents those experiencing it from seeking help. Freddie Cocker is a 24-year-old mental health advocate who suffered from loneliness throughout his life. We asked him his opinion on this issue.
It's definitely something that's still quite stigmatized, I think, especially if you say to someone that you're feeling quite lonely. I think a lot of the time people might not register what that actually means. I think there needs to be sort of a bit more education on what it actually means and how the emotion manifests in someone's mind, and how it's not just, a representation of someone who might be very introverted. It can also happen to extroverts as well.
Loneliness is a problem that affects 9 million people in the UK. But does social media have anything to do with it?
There are lots of people I know who have anxiety, and especially social anxiety, that really praise social media as a way for them to connect. So I think it can be a bridge as well as a barrier.
Valeria Martinez, CT News.